Hi, I'm Dr. Daniel Acevedo. I'm a comprehensive shoulder and elbow specialist here at DISC. Some of the most common shoulder conditions I see are shoulder arthritis, rotator cuff tears, massive rotator cuff tears, rotator cuff tear arthritis, shoulder instability, and frozen shoulder. I know surgery is a big deal for most people. So a lot of people see an orthopedic surgeon and think right off the bat that I'm going to offer them surgery. So I'm more of a comprehensive shoulder and elbow specialist, so I do the gamut of non-operative treatment, including recommending physical therapy, PRP injections, biologic therapies, and really try to max out somebody's non-operative treatment. And I try to reserve surgery as a last resort. So that way, both me and the patient know that that's what we need to do, and then I can get them a good result. And I think that if you treat patients like that, like they're your family, and you understand how big of a deal surgery is, I think that you're gonna have better results because they're gonna trust you more, they're gonna follow your post-operative protocol, and they're gonna have a better result. So my main philosophy is to treat everybody like their family, and I don't treat surgery lightly, even though I'm an orthopedic surgeon. My father was a first-generation physician. He was an ER doctor, so I spent a lot of time with him, really looked up to him. So as I went to undergrad at UC Irvine, and then I went to medical school at UC Irvine, I really engaged in the field of orthopedics. I was doing research early on, so I knew I was going to be an orthopedic surgeon from early on. I did my residency at USC, and there I worked with some of the great sports doctors, Dr. Taboni, Dr. Vangsness. Then I went to Thomas Jefferson University in Philadelphia at the Rothman Institute, which is the mecca of shoulder and elbow surgery, and I really became an expert that year. I did over 600 shoulder and elbow surgeries. So, I found the love of shoulder surgery through my residency, and it just grew as I did my shoulder and elbow fellowship. So when I first meet a patient, I really want to know what their complaints are. Where are they having pain? What are the activities that they can or can't do? And what it is they're trying to get back to. Are they trying to get back to tennis? Are they trying to get back to golf? Are they laborers? Are they retired and they're just trying to get good pain relief? So once I find out their goals, then I work with them to try to alleviate their problems. And usually it's pain and function, and try to get those things better without surgery at first. I also really kind of explain their x-rays and their MRI, and I take a lot of time to help them understand their problem. Most of my surgeries are minimally invasive. Even my total shoulder replacement, I used a small 6-centimeter incision. I've been doing outpatient total shoulder replacements probably for the last 7 to 8 years, and I would say that 85 to 90% of my patients can go home. So the patient's role in their own recovery is really important. I think that I really educate them. One of the biggest things I educate them is on nutritional status, and I offer them surgical supplementation to help them with nutrition. That'll help them decrease their complications. It'll help them recover faster. The other thing is that as shoulder surgery advanced over the last 15 to 20 years, we know how to move patients. I do more of an accelerated rehabilitation. So on post-operative day 1, on an anatomic total shoulder, I actually want them to move. I want them to do exercises. So I think for me, a lot of it is education and teaching the patient what they can and can't do, and making them confident that I'm confident in what I did so that they can trust their shoulder. They also need to go to physical therapy. Physical therapy after a shoulder replacement or a rotator cuff tear is paramount for somebody to have a good result, and they really kind of need to be in it to win it. So for me, it's just continued education and reinforcement that we're all in this together and it's not just them. I think if you have shoulder pain more than a few days, you should come to see me. I'm not necessarily going to offer you surgery, but I think it's good to get a diagnosis early on. I don't think you should ignore pain. I think pain is a signal of telling you something's wrong. And if you have pain in your shoulder, it's telling you something's wrong with your shoulder, and that's why I'm here, to help you figure that out.